Hi everyone. In today's clip, I will talk a little bit about stress and anxiety. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. We often use the words stress and anxiety together. However, one can be definitely without the other. Stress is a physical and emotional response to external pressures or threats. Anxiety is a persistent, excessive worry that interferes with daily life. It can be a symptom of stress or a standalone disorder. We have different types of anxiety disorders. We have generalized anxiety disorder, or GAD, which is a mental health condition characterized by persistent, excessive, and uncontrollable worry about a variety of everyday situations, even when there is little or no reason to worry. It can affect both adults and children and often interferes with daily functioning at work, school, or even in social settings. Then we have panic disorder, which is a type of anxiety disorder characterized by recurrent, unexpected panic attacks. Sudden episodes of intense fear or discomfort that peak within minutes and happen without any clear trigger, basically. Then we have social anxiety disorder. This is also known as social phobia, which is a mental health condition characterized by an intense, persistent fear of being judged or embarrassed or rejected in a social or performance situations. This goes beyond normal sort of shyness and can signify or significantly sort of interfere with daily life, relationships, and professional functioning. Then we have phobias, which are a type of anxiety disorder characterized by an intense, irrational fear of specific object, situations, or activities that pose little or no actual danger. People with phobias often go to great lengths to avoid the source of their fear, and exposure can trigger severe anxiety and panic attacks. Then we have obsessive compulsive disorder, or OCD. This is a mental health condition characterized by a cycle of obsession, unwanted, intrusive thoughts, images, or urges, and compulsion, which is the repetitive behaviors or mental acts performed to reduce the anxiety caused by these obsession. I have actually a separate clip on this posted earlier if you're interested to watch. Then there is post-traumatic stress disorder, or PTSD, which is a mental health condition that can develop after experiencing or witnessing a traumatic event that involves things actual or threatened death, serious injury, or sexual violence, and such. It affects people of all ages, and it can significantly sort of impair daily functioning if it is left untreated. General symptoms for anxiety disorder are rapid heartbeat, sweating, trembling, fatigue, gastrointestinal issues, irritability, restlessness, fear, dread, difficulty concentrating, and a whole lot more, because each of the anxiety disorder types can have many more symptoms of their own, actually. So the usual medical treatments that are considered are psychotherapy or cognitive behavior therapy, CBT, which is the most effective in most cases, and they might even use exposure therapy. Then there is prescribed medications such as NSRIs, which are antidepressants, and they're used for neuropathic pain and mood, and side effects can be dry mouth, blurred vision, constipation, cardiac conduction effects, or TCAs. They can also increase blood pressure and have GI side effects. Then there's SSRIs, or selective serotonin reuptake inhibitors, like Prozac and Zoloft and more. And short-term side effects vary from nausea and diarrhea and headache, insomnia and drowsiness and sexual dysfunction to weight changes, withdrawal symptoms if stopped abruptly, And long-term side effects are known to be emotional blunting, sexual dysfunction, weight gain, sleep issues, increased risk of bone fractures, and also bleeding. Potential links to higher risk of sort of diabetes and cardiovascular disease and cognitive impairment. So these medications have interactions with St. John's wort, 5-HTP, SAMe, causing a risk of serotonin syndrome. This is a serious drug reaction. It is caused by medications that build up high levels of serotonin in the body. Then there is benzodiazepines, which are a class of prescription medications that act as a central nervous system depressants, meaning they slow down the brain activity. These are fast-acting, but they do carry the risk of dependency and they're used short-term. Their side effects vary from sedation to memory issues, dependency, withdrawal symptoms, and a whole lot more. Then there is buspirone. This is a prescription medication used primarily to treat many forms of anxiety disorders. Unlike benzodiazepines, it does not cause sedation or dependency to the same extent, and it's not classified as a controlled substance. Side effects can be excitement, dizziness, nausea, headaches, nervousness, lightheadedness, movement disorders, and in some cases, serotonin disorder, which I explained previously. Now, on the orthomolecular medicine side, orthomolecular medicine focuses on restoring optimal biochemical balance using vitamins, minerals, and amino acids and other nutrients. Instead of recommending drug therapy, they will prescribe nutritional treatments, changes in diet, and even the elimination of substances that can affect or disturb brain function, such as alcohol and products that contain processed sugars. We don't simply take into account the mainstream causes of anxiety, but attempt to sort of identify other causal factors of anxiety, such as nutrient deficiencies, nutrient dependencies, food allergies, thyroid and adrenal dysfunction, heavy metal toxicities, and hypoglycemia. Each of these causal factors, or a combination of them, can cause dysfunction in the brain, causing mood to be sort of altered and anxiety to be expressed, and so on. Neurotransmitter deficiency syndrome is common in mood and behavior disorders. Trying not to get too technical here, but based on current research, we know that anxiety and depression, including bipolar depression, is caused by reduced number of brain neurotransmitters. Serotonin and catecholamines are master neurotransmitters. The catecholamines include hormones like dopamine, norepinephrine, and epinephrine. Conventional drug treatment attempts to increase synaptic availability of neurotransmitter pathways with SSRIs and SNRIs that I mentioned. However, these drugs depend on having enough neurotransmitters to do the job. Conventional medication doesn't act to increase the total number of neurotransmitters, and in an attempt to increase synaptic levels by keeping neurotransmitters in a hole or in a gap, there's further neurotransmitter depletion. So we often see subgroups of essential fatty acid deficiency, inadequate nutrition, dysglycemia, which is a term for abnormalities in the blood glucose levels, food intolerance, digestive compromises, malabsorption, B3 deficiency, vitamin C deficiency, heavy metal toxicity, B6 deficiency, zinc deficiency, hypothyroidism, and adrenal fatigue, and a whole lot more, right? So B3 and C are anti-stress vitamins. A good portion of mood and behavior dysfunction patients do better with moderate doses of B3 and C. So the key nutrients for anxiety relief that is suggested would be things like vitamin B1 or thiamine, vitamin B3, which is niacin, which enhances serotonin production and has sedative effects, vitamin B6, magnesium, which supports nervous system and reduces stress, omega-3 fatty acids, which are anti-inflammatory and support brain health, and other supplements containing adaptogens such as ashwagandha or rhodiola. Cognitive enhancers and essential nutrients also to support stress resilience and cognitive function. Among alternative therapies, mindfulness and meditation reduces stress and improves emotional regulation. Yoga, Tai Chi, combine movements and breath work and meditation to help calm down. Acupuncture stimulates energy flow and can reduce anxiety symptoms. Massage therapy reduces tension and promotes relaxation. Biofeedback helps control physiological functions like heart rate, and herbal remedies such as valerian root, which has sedative effect, chamomile, which has mild calming properties, lavender, which reduces anxiety and improves sleep. But I need to also remind you that everything can have a side effect. So before taking any herbal remedies, consult your healthcare provider to ensure there's no drug interactions. If you are on any medication or have any allergic reactions. On the metaphysical and spiritual side of this, anxiety is often seen as a signal from the soul or higher self. Disconnection from self or purpose. So anxiety may raise when one is out of alignment with their true path in life, so to speak. Unprocessed emotions like buried trauma or unresolved grief, fear of change or fear of unknown, resistance to transformation, spiritual awakening. Anxiety is a catalyst for personal growth. Energetic imbalances like blockages in chakras or energy fields. So the energy healing practices I just mentioned earlier can be quite beneficial to release and heal you emotionally. Hope this has been helpful. Like and follow for more. Be the light.